Hey everybody, and welcome to Autism Awakening, the podcast that helps you help your child with autism. My name's Dr. Jared Skowron, and I've been a biomedical autism doctor for over 20 years. And this podcast is to educate you guys as family members and parents and grandparents, or anybody who works with kids with autism, on the different medical interventions that you can use to help your child. So today's podcast is going to be about PANDAS and PANS. Now, PANDAS and PANS might be very familiar to you, or PANDAS and PANS might not be familiar to you at all, because a lot of conventional doctors don't even believe in PANDAS and PANS as an actual diagnosis. But please trust me, it is an actual medical diagnosis. It's being, investigated and researched in the community. So eventually doctors will be on board. But right now, your child may be dealing with PANDAS or PANS, and you need a way to help them. So that's what we're going to talk about today. What is PANDAS and PANS? How does it affect our kids specifically with autism? And of course, what we can do about it naturally. So let's kind of jump into what is PANDAS and PANS. And then of course, we've got lots of scientific research to kind of back up and support so that more people can learn and understand what this stuff is. All right. So PANDAS and PANS, as an overall review, is an autoimmune disease against the brain. Okay, it's an autoimmune attack against the brain. What does that mean? It means that our immune system is attacking itself. Okay, so an autoimmune condition in general is our own body, our own immune system, attacking a certain part of it. So, for instance, some very common autoimmune diseases are something like rheumatoid arthritis. Rheumatoid arthritis is an autoimmune attack against our joints. All right. Something like Hashimoto's, which is a thyroid condition, is an autoimmune condition that attacks our thyroid, or lupus is another very common autoimmune condition. So an autoimmune condition in general is when our own immune system attacks itself. Okay. So how does that differ PANDAS and PANS? Well, PANDAS and PANS is when that autoimmune attack attacks our brain. So let's kind of go from that into what are symptoms and how can you kind of figure out, geez, does my child have PANDAS or PANS? And if so, what should I be looking for? All right. I would say the number one thing to look for is an immediate change in behaviors. Okay. An immediate change in behaviors that normally occurs after an infection. All right. So your child is has a cold, your child is sick. I know right now, it's December of 2024 and there's a lot of pneumonia going around the country. So when your child gets sick with a cold, with a flu, with whatever, do they have an immediate large change in behaviors? That's probably the number one most important thing for you guys to keep in your mind. Okay. Now, what does change in behavior mean? It's kind of a broad comment. It means usually a lot of anxiety, and it usually means a lot of behavioral responses to that anxiety. Now, when we get anxious as humans, we go into a fight or flight reaction. So your child may go into a flight reaction and just be very avoidant and be very withdrawn and be very defensive. So when they're doing their own thing, they're good. But if you say, hey, let's get in the car, let's go to therapy, let's stop your iPad, then they trigger with a huge kind of reflexive defensive response. So that's the flight of fight or flight. You can also go into a fight mode, and that fight mode is exactly what it says. It's anger, it's aggression, it's violence. So, geez, you were just sick and now you're scratching me, you're ripping my hair off, you're banging your head against the wall. Okay? Those are kind of the behavioral changes you're going to look for with PANDAS and PANS. And remember, it comes after an infection. Now, another thing that we talk to our families about in our telemedicine practice, when we talk to them about PANDAS and PANS, is how long do those behavioral changes last after a cold or an infection? And trust me, for doing this for over 20 years, those behavioral changes can last for weeks to months after a cold. And look, I understand. We've all been sick. We don't feel good. Maybe we're cranky. Maybe we're isolated when we have a cold, and that's normal. But when that cold is over, when our immune system has killed off that virus or that bacteria or whatever, we should go back to a baseline. So if your child does not go back to a baseline, another sign for PANDAS or PANS. Okay. I would also think about this, and then we'll get into the research, that we always ask our patients in our telemedicine practice, how does your child respond when they have a fever? Okay. And let me mention two things for the response. Some of our patients will say, you know what? When my child gets a fever, they are amazing. I've even had patients say, my kid's nonverbal until he gets sick. And when he gets sick and has a fever, he starts talking. And amazing things happen with a fever. Okay? That's one potential response. The other potential response is, oh my gosh, when he has a fever, or she, we normally say he because the prevalence of boys with autism, but this goes for anybody, that when they have a fever, wow, things are just absolutely horrible. Just absolutely horrible at all. And the third response is, you know what, my kid doesn't really get sick. They really don't mount fevers. So those are kind of the three responses that we get. If your response to, hey, when my child has a fever, things are miraculously better, then you probably do not have PANDAS or PANS. So if your child gets better with a fever, do not have PANDAS or PANS, most likely have some kind of long-term chronic infection. And when the immune system and the fever mount up and you give them, and the immune system starts killing off infections and things get better, well, that means there's some infection making things worse. Okay. Now, if your child has the opposite response, when my child has a fever, the poo hits the fan, the behaviors are off the wall, that's more of a sign of an autoimmune reaction with PANDAS and PANS. Because when the immune system mounts up, everything the immune system is attacking is going to get stronger. Both the virus and the bacteria that you're fighting because you're sick, as well as autoimmune conditions. So autoimmune conditions are going to be worse with a fever. All right. And then the third thing is, geez, my child doesn't mount a fever. Well, that really doesn't help us, but it definitely shows an overactive immune system that is getting, we all get viruses, we all get bacteria, they're everywhere, but your system is fighting it so fast that there may be an indication under there that, hey, if it's going too fast, are we also dealing with autoimmune issues? So that's kind of the symptomatic process of getting in your mind, does my child potentially have PANDAS or PANS? Okay. Now, let's go from that to lab testing. Unfortunately, there is no good lab work or lab testing for PANDAS and PANS. There are some things you can look for. You can look for the infections. Remember, PANDAS or PANS is an autoimmune condition against the brain caused by an infection. We'll go over how that happens in a minute. So you can test for different infections and see if your body is fighting infections. And if you're lucky enough to pick the right infection, you might find it. But there are so many infections out there. How do you know which one is the trigger? That's part of the problem in the testing. We can also look for antibodies that attack the brain because it's an autoimmune condition. We've got some part of the immune system attacking some part of the brain. So those tests do exist. And there's one test out there that's popular called the Cunningham panel, but it's not very comprehensive. It's not very thorough. It does look for a few antibodies against the brain. So if you do find one, well, okay, that could be definitive. Hey, you've got PANDAS and PANS because that antibody's there against the brain. But again, the Cunningham panel is not comprehensive or thorough. So there are other antibody tests out there that'll look at antibodies against other parts of the brain. Let me say this though. Most docs are not familiar with these. Even rheumatologists, and rheumatologists are the experts in autoimmune disease. I ran one of these brain autoimmune panels through a regular lab. So the lab that I used was Quest, but other conventional labs have these tests. And there were antibodies against different parts of the brain based on this test through a conventional lab. So I sent that to a rheumatologist. I said, hey, this patient really needs help. I believe they have autoimmune encephalitis, PANDAS, PANS. Rheumatologist was clueless. They said, I don't know what these are. I'm like, well, these are antibodies attacking the brain in this child, and you're the autoimmune specialist. So let's do it. But I feel like this science is so new, it's falling on deaf ears in the conventional community because they're just not familiar with it. Okay. But we've got to get up to speed. If this condition is affecting your child, conventional medicine and alternative medicine needs to know how to help. All right. So again, there is testing. I wouldn't say it's the greatest, and you can have a test that's normal but still have PANDAS and PANS because the testing just isn't comprehensive. Okay, let's move there to treatment, and then we'll go into the science, and then we'll answer our live questions. So treatment for autoimmune conditions. In the conventional world, it's anti-inflammatory. It's suppressing the immune system. If the immune system is causing the problem and you stop the immune system from functioning, well, then that problem will improve, okay? So that's the conventional model of treating autoimmune disease. Problem is, when you suppress the immune system, you also suppress other things that it does, like fight cancer. And so we get this increased risk of cancer with strong immune system suppression, like with prednisone. And it's going to cause other issues and medical issues as well. So there are other types of conventional autoimmune treatments that are coming out. They're more specific to interleukins and cytokines and, tumor necrosis factor. And you'll see this in different ads and commercials for autoimmune medications. I would say the most prevalent one is probably different rheumatoid arthritis commercials that talk about medications, immune modulatory medications that'll help, not by suppressing the whole immune system, but targeted. All right. But the science isn't there yet on how to help with PANDAS and PANS. So what we need to do is this balance of suppressing the immune system just enough so you don't get these symptoms attacking the brain, but your immune system is still functioning otherwise, in combination with killing off the infection. So remember, when we go back to PANDAS and PANS and how it occurs in the body, we have an infection that triggers an autoimmune condition against the brain. That infection may still be in the body. We do have chronic infections that can live in the body for years, if not decades. Different viruses like herpes, like chickenpox, different bacteria like strep can live in your tonsils or adenoids and just continue reinfecting you. People who have long COVID, what else? Parasites, Lyme disease. There's a lot of infections out there that can live in the body for a long, long time. And if that infection is the trigger, then we need to get rid of it. So the second part to dealing with PANDAS and PANS is long-term antimicrobials. If it's a bacteria, kill the bacteria. If it's a virus, kill the virus. Wherever it is, get rid of it. So it's that combination of killing off an infection that's chronically in the body, along with anti-inflammatories. That's pretty much our best medical way to go about handling PANDAS and PANS and the behaviors from those. Okay. I will say I'll get to that in a minute. No, it's not the time for that. Let's get into the science, everybody. A lot of people showing up live, and if you're listening later, if you guys are listening to this podcast, on Podcast World or on YouTube, I want you to know we record our podcast live every Thursday at 12:15 p.m. Eastern Standard Time on our Facebook page. So you can go to Spectrum Awakening Facebook page. Every Thursday, 12:15 Eastern Time, I take my lunch and we talk about a medical aspect of autism. All right. So there's a lot of science on PANDAS and PANS. And I saw a comment fly by that says, my doctor doesn't believe it exists. Well, they probably were not taught about it in medical school. But guess what? There's a whole lot of science behind it, which we're going to talk about. So it's time for those doctors to educate themselves on what's new in the medical world. All right. So here's a research study talking about the treatment of PANDAS and PANS, a systematic review. Okay. Pediatric, autoimmune neuropsychiatric disorders. That's what PANDAS is the acronym for. PANDAS and is a subtype of acute onset OCD, thought to be caused by an autoimmune response. The proposed treatments include antibiotics, antimicrobials, kill off the infection, and immunomodulatory interventions. So again, kill the bug and balance that immune system. All right. People have been giving in research studies antibiotics like penicillin and azithromycin, different immune modulators like IV, IG, removing your tonsils and adenoids, which we'll talk about a little bit later, I think is extremely effective. Cognitive behavioral therapy, and then different anti-inflammatories like NSAIDs and corticosteroids. Okay? A good summary of this is how we treat it. So, here's a research study about the clinical features in patients with PANDAS and PANS. And I just wanted to kind of highlight a little bit of this abstract. It talks about major symptoms being irritability, aggression, food restriction. Okay? So all of our kids who are picky eaters and dealing with that, do they have PANDAS or PANS? It's a good question. All right. This research study showed those as major symptoms that are more with PANS than with PANDAS. But again, PANDAS is also very similar. Let me take a step back. What's the difference between PANDAS and PANS? Okay. PANDAS and PANS is the same thing. caused by a different trigger. So this is probably a good time to explain how it happens. How does pandas and PANDAS happen? We get a cold, bacterial infection like strep, or a viral infection like the flu or whatever, and the immune system attacks it. Great, that's what it's supposed to do. It's supposed to kill off this bug. What if that infection, that bacteria, that virus, was very similar in how it looked to our brain, or a part of our brain? Okay. What if there were two identical twins in the world and one of them committed a crime and they got it on video? They're like, well, this person who looks like this committed the crime. Like, well, there's two people who look like that. Who is it? Which of those identical twins is it? All right. That's what the immune system is dealing with PANDAS and PANS. It sees the infection, the strep, the virus, or whatever, attacks it, and then says, ooh, the brain, it looks just like that infection. I'm going to attack the brain. All right. So that's how it happens. From how things are defined and named, PANDAS is this reaction after a strep infection. PANS is this reaction after a viral infection. Okay? That's the only difference between PANDAS and PANS. Frankly, in my mind, it's the same because it's an autoimmune condition from an infection. Okay. Let's continue. You may ask me what virus. Oh, almost all the viruses. You just wait. What's next? Here's, I had talked a lot about this a few years ago because it was prevalent. PANDAS and PANS in the COVID age. Okay. We present the cases of 5 adolescents with PANS whose symptomatology increased following COVID infection. We hypothesize that the pathogenic mechanisms of silent viruses, such as Epstein-Barr and COVID, are related to neuroinflammation, immune responses, and additional roles played by social isolation-related inflammatory processes. That's a lot to unpack, but let's talk about it. COVID's a virus. It can trigger an autoimmune condition in the brain, okay? And along with other viruses like Epstein-Barr. They are related to brain inflammation, immune responses, and this social isolation, which is caused by inflammation in the brain. Okay? And trust me, I saw plenty of PANS flares. Plenty of PANS flares after COVID. Period. Okay? Here's another one. Neuroinflammation in OCD, also in Sydenham chorea, PANDAS, and PANS. So there's an old condition called Sydenham's chorea, which symptomatically is the same description as PANDAS and PANS, okay? Almost to the T. And it's my belief that PANDAS and PANS is just renamed Sydenham's chorea. So your doctors who don't believe in PANDAS or PANS should understand what Sydenham's chorea is. All right. The treatment of these disorders, okay, depend on complementary modes of intervention, including treating the symptoms, all right? Treating the source of inflammation, which is the infection, and then treating the disturbance of the immune system. So you're seeing the pattern. Okay. The pattern is reduce the inflammation, kill the bug. Okay. Here's another kind of difference with PANS and PANS. Subjects with greater persistence, symptom persistence, were significantly more likely to report PANS flares associated with infections with close contacts, reporting exacerbations in symptoms after vaccinations, after environmental triggers, and PANS recurrences were triggered by Epstein-Barr or mycoplasma or sinus infections. PANS was also associated with significantly higher frequencies of sleep problems, wetting the bed, muscle pain, brain fog, sensory, defensiveness, irritability, and aggression, and less effectiveness from IVIG. So when you have PANS versus PANDAS, if you're getting IVIG, it's less effective. You also have more difficulty attending school. So a lot of symptoms here that sure match our kids. Let me just read them again. Sleep problems, toilet training problems, brain fog, sensory defensiveness, irritability, aggression, more difficulty attending school. This sure sounds like a lot of the things we deal with, guys. Okay. All right. Last but not least, I found this research study very intriguing, and it was actually done by doctors near me at University of Connecticut, and UConn Med School is great. This is a study, symptom flares after COVID-19 infections versus vaccinations among young kids with PANS and PANDAS. So they saw kids with PANS and PANDAS, saw those that had COVID, and then those with the COVID shot that didn't have PANDAS. Okay, and they compared them, which I found this very interesting. All right. Among children reported to have had a COVID-19 infection, 43% reported severe flares of PANS and PANDAS, 23% reported mild flares, 30% reported no flares. Among those who had received their COVID shot, 66% observed no changes after the vaccine. But guess what that means? If there's 65%. 65% had nothing, then 35% did. We saw 19% with mild flares and 15% with severe flares. So even after the COVID shot, you were seeing PANS and PANDAS flares. Not as much as with the actual infection, but it's still there. So it's important to look at the research and the science that's out there. So that's the research that I brought today. So let me kind of sit back and summarize. The science and the research that I wanted to present really kind of supports the description that I was giving you, okay? Which is, I get a cold. It can be bacterial, it can be viral, whatever, all right? And then during the cold, you're going to have behavior changes because you're sick. After that cold, what is your life like, okay? Is it all of a sudden these huge behavioral changes? We mentioned the irritability. We mentioned the sleep. We mentioned the sleep problems. We mentioned the bedwetting. We mentioned the sensory disturbances and the picky eating, okay? Do those behaviors last for weeks to months after a cold or an infection? That's your biggest clue that your child may be dealing with PANDAS and PANS. Lab tests, they're out there. They're not great. I feel that the symptoms are much more obvious than the lab testing is. So what do? Okay? Kill the bug and modulate your inflammation. How do we do that? Naturally. All right. There's obviously pharmaceutical things you can do, antibiotics, antivirals, IVIG, which is an intravenous immune treatment. Those are the common ones. But from a natural standpoint, I think you can use the natural treatments or add on the natural treatments to what you're doing. What are those? Number one, let's talk about the immunomodulators. The three biggest ones that I think are helpful are going to be our Panda Bear supplement. So Panda Bear is a great anti-inflammatory. The active ingredient is called PEA, palmitoyl ethanolamide, and it's an amazing anti-inflammatory. It's just incredible. A lot of great research behind it. I should have printed out some for us, but I didn't today. But we'll get there. So that's great, and we have made it into a tasteless powder. So you can mix this powder into anything they're eating and get that anti-inflammatory in them. It's not water soluble, so you can't mix it in a drink, but you can mix it in any food. Tasteless. The next one is curcumin. So curcumin is a wonderful anti-inflammatory that you can give as well. There's a lot of curcumin supplements out there. We have one at Spectrum Awakening called Curcumise. We combine it with another anti-inflammatory, which is great. So it's got those two together. And the third thing I would say would be omegas, fish oil. Fish oil is also another great anti-inflammatory, especially the EPA. DHA good for the brain, EPA good for the inflammation. So if your child has PANDAS and PANS, probably want to get a combo EPA, DHA, omega. All right. So those are the anti-inflammatories. Now, let me give you a side caveat to this. If your child gets sick with a cold, with a flu, whatever, stop your anti-inflammatories temporarily. We want the immune system to kill off that infection. So, if you've got strep throat and you're giving anti-inflammatories, well, the infection's going to last longer because the immune system doesn't have the strength to fight it off. So if you are giving anti-inflammatories like, again, Panda Bear, Curcumise, omegas, stop during an acute cold and infection. When they're better with that cold and infection, then add them on. Okay? And I've seen this. I've seen this with kids who are like, geez, they got a cold and my other kid's lasted 3 days. He's on 2 weeks. And we're giving these anti-inflammatories. Stop those anti-inflammatories for now. Same thing goes with over-the-counter anti-inflammatories. If you're giving ibuprofen, okay, it's going to extend how long you're sick for anything, for anyone. All right. Now, so those are our natural things as anti-inflammatories with that caveat. Secondly, the antimicrobials. So natural antimicrobials are great because they're very broad spectrum. So if you have a viral trigger for PANS and you're giving antibiotics for PANDAS, it's not going to work. Okay. We saw a research study. IVIG works well for the strep-induced PANDAS, but doesn't work for the viral-induced PANS. Okay. So the natural things are much more broad spectrum, which is why I love giving our colloidal silver, our grapefruit seed extract. If you can swallow pills, we have things, we have supplements like our Biocillin or our Paraslayer. I would swallow those capsules. They taste pretty gross when you open them up. But, different antimicrobials are going to be very effective. So I would add those on. And the third thing I would say, and I've seen this in my patients time and time and time again, take out their tonsils and adenoids. These infections often live right here where we breathe them in, okay? We breathe in those infections, they get into our immune tissue, the tonsils, the adenoids, and it's tough for the immune system to get rid of them out of there. So you want to make sure, talk to an ENT. If you know you're dealing with PANDAS or PANS, talk to an ENT about getting rid of the tonsils, getting rid of the adenoids. I've had people go into PANDAS and PANS remission after taking out their tonsils and adenoids. Doesn't happen all the time, but I would definitely say it's something to consider and something to try. All right. So that's kind of our review of PANDAS and PANS. It's all about behaviors. It doesn't cause autism, but it's often prevalent in our kids with autism. And I say that because some subsets of autism are an autoimmune attack against the brain. So it's going to happen. So that's really what we want to watch out for. So think about those symptoms with your kids. Again, the testing is off and on. If you have a test and it's positive, you probably have PANDAS or PANS. If you have a test and it's negative, I wouldn't rule it out. Look at those symptoms. And you're going to go treatment-wise with anti-inflammatories when you're not acutely ill, antimicrobials long-term, and take out those tonsils and adenoids. That is your three-prong attack. All right, let's get into some of the live questions. Let's get our coupon for the weekend first. Coupon for the weekend is PANDAS 20. PANDAS 20 going to get you 20% off any of our supplements, any of our lab tests. That expires December 8th, 2024. If you want one-on-one help, if this is a lot, you want to talk to a doc about it, go on our website and schedule a telemedicine video appointment with me. You can do that right on our website. Go to Spectrum Awakening, click appointments. It's right there. All right. Let's get into our live questions. All right. Let's see. Live shout out to Audrey. Live shout out to Rodney. Rodney's always on. Jasmine. Hey, Jasmine. It was good to see you the other day. Good morning. Hope you had a good Thanksgiving. I did. Hope everybody here in the U.S. had a good Thanksgiving as well. Charlie's sick this week, so I'm hoping he doesn't have another flare. I'm also interested in what you think about IVIG. Our PANS functional doc thinks he will need it one day, but seems so invasive to put a child on. Well, first off, I'm sorry he's sick. Make sure we give lots of antimicrobials and stay away from the anti-inflammatories for now, till the cold's better, and then hit the anti-inflammatories. What do I think about IVIG? I think it works when it works. Okay. Even one of my best friends, from college, I was best man at his wedding. His teenage daughter is neurotypical and has PANDAS. Okay. And IVIG has worked for them. IVIG worked for them. Doesn't work for everybody, but it's something to consider. It is invasive. You're putting a needle in your kid's arm and having them sit there for a little bit. But if for some people, it works really well. Not everybody, but it's something to think about, Jasmine. All right, Sandra, my autistic child has ADHD. What do you recommend he takes? I would say this, Sandra. With ADHD, and autism, we're looking at imbalances in brain chemistry. So I would consider the Skowron solution. So the Skowron solution is 4-part protocol of 4 different supplements that'll balance brain chemistry, and you can adapt them. You know, hey, this one worked really well. Let's add a little more. This one, he kind of got triggered. Let's add a little less. So it's very adaptable to the individual. But I would go there. All right, hold on. I didn't think my eyesight could get any worse. Angie said, good morning. I learned a lot from this podcast. Great, Angie. Thank you for listening. And what I need from you guys is to spread the word. Okay. I've been doing this podcast every week for 6 years now, and I love it. Love helping you guys help your kids, but we need to spread the word. So share this with a friend, with a colleague, with a family member, with anybody. Let's spread the word with your doctor that there's science. There's science. Okay. All right. Jasmine, again, with Charlie, says, I'm also interested to see what you think about steroid bursts. This is suggested for us. I'm a little uneasy about anything that isn't natural. Well, I'll tell you this about steroids. I'm kind of on the fence with them because they can give you dramatic improvement. Okay. But they can also cause hyperactive behaviors. So it wouldn't hurt to try a burst of steroids, like try prednisone for a day or two and see what happens, but be careful of the hyperactivity because it's very, very common. And you never want to do steroids long term. All right, what else do we got here? Sandra, My autistic child, he's 4 with ADHD, takes risperidone. Can they also take super serotonin? Yes, they can. Let me say this as a side note about risperidone. I don't like it. Okay? I don't like it. It's a pharmaceutical straitjacket. You've got a kid, and first off, risperidone's job, what it does is stop violence and aggression. It was the first medication approved for autism, but if you don't have violence and aggression, do not give risperidone. It's going to turn your kid into a zombie and throw on 50 pounds. Okay? I don't like it at all. If your child is violent, they're aggressive, they're hurting themselves, they're hurting others, it's a potential option, but it doesn't cure it. It just sits them in a corner in a straitjacket, and it doesn't allow them to express themselves. But the cause of the violence and the anger is still there. And that's what you've got to treat. So, Sandra, I want you to go back in my podcast to anything about behaviors. Most of our kids who are violent and aggressive are in pain. Okay? They don't need risperidone. They're in pain. And once you treat that pain, then the violence and aggression goes away. So I want you to watch that podcast because we talked about it a lot. But you want to go after a GI infection. You want to go after a stool infection, or where is the child hitting themselves? If they're hitting themselves, if they're holding their head in their mouth, maybe they got a tooth issue, a cavity, or an abscess or something, okay? They're hitting their head, or they're hitting their ears. Do they have an ear infection? If they're hitting their head, do they have a migraine or seizures? If they're always pushing on their belly, do they have a stomach infection? That's the road out. That's the cure. It's not the Band-Aid. And again, risperidone can prevent violence, which is great, but it's not a cure. Linda Lynn says hello. Hi, Linda Lynn. Missy, this might be off topic, but I'm actually sitting in a room with my autistic daughter doing a reevaluation. They're talking about getting tests done, such as blood tests. What should I be asking them about? What about the stool test? Please help me. We're almost done here. All right, Missy, here's what you want. Urine test, you want organic acids, you want methylmalonic acid, and you want carnitine. Okay? You can also do heavy metals there. A stool test or a poop test, you're looking for infections, and you're looking for an inflammatory marker called calprotectin. In the blood, what I would look for is thyroid, B12, iron levels, vitamin D, and also an MMR titer. MMR antibodies will give us an indication if your immune system is attacking a virus that's in the body that may potentially be attacking the brain. Because we have research, I didn't show it this podcast, but in November I did. There's research studies associating antibodies to the measles virus and antibodies against the brain. And they are correlated and present in our kids with autism and not present in neurotypical kids. So get that MMR titer or MMR antibody blood test. So there you go, Missy. I hope that helped. Rahila, is autoimmune connected to antibodies? Yes. Our Cunningham panel shows elevated anti-dopamine receptor and anti-tubulin titers. He always has high IgM and high IgM and IgG to mycoplasma pneumonia. So, Rahila, this seems pretty textbook, okay? You have antibodies, you have an immune response to the mycoplasma infection. The IgM antibody means you're attacking it right now and it's in the body, period, okay? Then you have antibodies against the brain. Your Cunningham panel was positive. This sounds like a classic PANDAS textbook description, okay? So go hardcore, treat it. Tonsils out, adenoids out, antimicrobials, anti-inflammatories when not acutely ill. Do it. Connie, my doctor told me yesterday that PANS and PANDAS does not exist. Well, I hope your doctor will educate themselves on advances in medical science. Jasmine, do you think the HTMA test is helpful? Jasmine, I don't know what that is. If you want to spell out what the HTMA acronym is, I'll answer that question. And don't apologize for asking questions, Jasmine. That's why we do this. This is why we're here. Steph, do you have anything new for sleep and for staying asleep? Well, if you haven't tried our sleep cream, you can try that. I also like our super serotonin support. I like magnesium, but it can also be due to infections. I have a lot of kids, once we treat their yeast in the gut, they sleep. So think about those options. Jasmine, says the Cunningham panel is so pricey. It is. The Cunningham panel is a blood test for PANDAS and PANS. Again, it's popular because it was the first one out on the market. I don't think it's comprehensive. I think there are other antibodies against the brain which occur, and it is pricey. I agree. Carolyn, can 5-HTP and SSRI decrease the levels of dopamine? Slightly. The SSRI, I don't know. The 5-HTP, yes, slightly, but not huge. Ellen says, strep and COVID are the main issues for my son. Would Viragon help shift COVID? Yes. So would our Vira Clear and glutathione and NAC. We're starting homeopathy to see if we can help him shift the strep. That's great. Take his tonsils out. Okay. Sandra, I've talked to a couple of places about stem cell therapy for autism. Duke, and had great success. What are your thoughts on stem cell therapy? All right, everybody, listen up. Here is my standard answer for stem cell treatment for autism. I have never seen it work long-term for autism. Never once. And this is from patients coming back and saying, hey, I did stem cells and this is what happened. All right, I learned from my patients. Not one of my patients has said that it's benefited them long-term. Some have seen a mild improvement for a few months and it goes away. None of the improvements from any of my patients have persisted. In addition, when I'm at autism conferences talking to autism docs that are in the field, okay, not doctors who work for a stem cell company, doctors in the trenches like myself, none of them have ever seen improvements that are persistent and long-lasting with stem cells. It sure sounds great that we have to pay a lot of money and go to a foreign country and get something done. It must work, okay? Duke University is doing it. It must work. Personally, I've never seen it with autism. I don't know any of the doctors that I trust seen it work as well. I hate to say that and be the naysayer, but that's our experience. Connie, my son, then again, Sandra, let me back up. If you can get into Duke and insurance can cover, then why not? Okay, besides the pain of the extraction of the stem cells. If it's free, not going to hurt, okay? Except for the needle. Connie, my son has strep right now. Please help. Well, get on some antibiotics and get on some natural anti-inflammatories, our colloidal silver, our biocillin, if you swallow capsules, our grapefruit seed extract. Use those as well with the antibiotics and now watch for the flare. The flare happens, use the antimicrobials, the natural ones long-term, potentially get some IVIG, and then hit with the anti-inflammatories like our Panda Bear, our curcumin, and omegas. Jasmine, what about cytomegalovirus? Can it cause PANS? Yes. Hello again from Germany. You're the best. Guten Tag, Jasmine. Ich vergessen alles. Mein Allemann. Look, we've seen so many different viruses and bacteria cause PANS or PANDAS. So I think it's anything. I mean, we see COVID causing PANS or PANDAS in the science and clinically. So yes, I think a multitude of viruses, including cytomegalovirus, can do it. Carolyn, from Sweden, right? My son has low catecholamines, but high tyrosine levels. What can that indicate? That indicates that it's not converting. Usually the things you want to add are folinic acid, vitamin C, and iron. And a lot of our kids are iron deficient. I think that's because a lot of our kids may not eat beef, so they eventually become anemic. And you can also lose iron with inflammation. So our kids who are chronically inflamed, that can happen. All right. Kieran, can superserotonin cause aggression if kids have an MAOA mutation? I don't believe so. I don't believe that can happen. But I have seen kids get aggressive on our superserotonin supplement. Not many, like 5 or 10%. And I think that occurs because serotonin also has activity in the gut with peristalsis. So I think if our kids are constipated, then the serotonin trying to move that poop is causing the pain and therefore the aggression. So I would do this. If you take our superserotonin supplement and you see aggression or hyperactivity, stop it for now. Move their poop, like use our brown log train or whatever you use to treat your kid's constipation. Hopefully not Miralax. And then once their poop is moving on a regular basis, then add it back in. It may also be the vitamin B6, which is in that formula, which can trigger some kids. Shannon says, can pandas and Hashimoto's coexist? I don't know. That's a great question, Shannon. I'm going to say possibly, but I really don't know either way. That's a guess. Jeannie, hey Jeannie, she's always on. Try super serotonin, works for my boy. That's probably for the sleep. A lot of our kids do really well on super serotonin for sleep and language and mood. Zulika says, my son has both pandas and PANS. Yeah. Why not? Carolyn, what's more effective, an SSRI or 5-HTP? It depends on the kid. I see most kids do great on 5-HTP. I've seen others where it doesn't work, but the SSRI, which is an antidepressant like Prozac or Lexapro, does work. So I tell my patients, start the 5-HTP first. If that doesn't seem to get what you want, stop it, try the SSRI, see what happens. Zulika, for how long can I give Pandabear? This can be given long-term, Zulika, but again, when your child's acutely ill, stop it. T, what will be the protocol to give a 5-year-old yeast mold biofilm, colloidal silver, gut binder, grapefruit seed extract, and sac boulardii? Give all that stuff together, except for the sac boulardii. Give that at a different time of day, okay? So the yeast mold biofilm, the colloidal silver, the gut binder, the grapefruit seed extract, all together in the morning and the afternoon, and maybe the sac boulardii in the middle of the day. All right, great questions, guys. Amber, my son has PANDAS and is currently going through a flare with strep. His functional medicine is recommended antibiotics, which I don't want to do because he already has severe gut dysbiosis. All right, I hear you. What can I give to help get rid of the strep instead of antibiotics? I'm already giving Pandabear and colloidal silver via a nebulizer. Add on the grapefruit seed extract. Again, add on other natural antimicrobials. If your child can swallow pills, try our Biocillin or our Paris layer. Don't open those. They just taste horrible. But keep on the colloidal silver and the grapefruit seed extract minimally. And again, tonsils out, adenoids out. Carolyn, can sulforaphane, that's broccoli extract, can that work for PANS or PANDAS? I've never seen it work, but I've never seen it not work, so I just don't know. Jasmine, I love this. Please contact Joe Rogan. I know that the backfire would be huge, but consider it. Jasmine, I love to be on Joe Rogan. Let me say this. I'd be happy to reach out to him. But if any of you have an in, you know a producer or something, reach out to us and would love to. Love to. Jasmine is talking to a couple other moms. I second the super serotonin for sleep. It helped my son Charlie sleep through the night for the first time in 6 months. It's a lifesaver. We never go anywhere without it. Thank you, Jasmine. I love that. Amber, I'm so thankful for finding you, how your videos have helped me help my son. Amber, that is exactly why I do this. So you're welcome. I'm glad you found us. And remember, now pass it forward. Share it with another family. Share it with somebody else so they can be helped as well. Gata, can child return back to his normal state after treatment of PANS and PANDAS? Yes. When? Oh, it's a long journey, guys. I hate to be the bearer of bad news, but autoimmune conditions are tough to treat, period. All right. So PANS or PANDAS as an autoimmune condition, you're looking at months to years. It's a gosh darn long time. But like I said, the thing I found that is the potentially quickest way to remission is tonsils and adenoids out. Period. Angie, wow, I didn't know about COVID and my daughter recently had COVID. Probably not helping with the aggressive behaviors we're dealing with. No, Angie, get on those antimicrobials and the antivirals, like our Viragon, like our ViraClear. Connie, my son has strep right now. Should I continue the antibiotics? Yeah, get rid of that strep. Definitely. Okay, antibiotics save lives. Antibiotics kill bacteria. I mean, talk about one of the first classes of medications that science came out with that works great. Okay? Yeah, we have side effects. We have gut die-off, we have probiotic die-off and some gut issues. But if you got strep, you want to get rid of it. Okay? So finish your antibiotics, add on some other antimicrobials, add on some probiotics to, replenish what the antibiotics killed off. But again, tonsils, adenoids. Sherry, thank you. I was a winner for the last contest. I can't wait for my new supplements. Sherry, I'm glad you won. We have contests all the time. I'm glad you're getting something. Got it. My child has tonsillitis without high temperature, and it's a sign of low immunity or because I use PEA. If your child has an active tonsil infection right now, stop the PEA, go with the antimicrobials. Haley, what about recurring impetigo? My kids rarely get sick, but we had impetigo in our house 2 years ago. It's been recurring. It's strep. I got to say just the same things. Okay? Antimicrobials and tonsils, adenoids. Connie, my son's been hitting me so hard since he was 16. That's not right. No, we don't want anybody hurt. Connie, he may be trying to communicate with you that he's in pain. If I give you pain, maybe you'll understand that I have pain. Talk to him about it, okay? Even if our kids are nonverbal, they usually have really great receptive language. Talk to them about pain. Where does it hurt? Can you point to it? I want to make you feel better, okay? It's hard to be empathetic when you're being attacked, but try to get there with him and understand that frustration is pain. And if you can stop the pain, then he's going to feel better. And then you're not going to get hit. Megan, as you're using these antimicrobials, are they going to have loose stool as they pass this infection? Maybe or maybe not. Is it a sign that it's working? Yeah. And it's also a sign to add a gut binder. Okay, like our gut binder sweet tasting. Jasmine, that makes so much sense. I had my tonsils taken out at 7 years ago, and I haven't really been sick since. Maybe I need to go to see an ENT. I would, Jasmine. I mean, it doesn't, again, obviously everything I do is natural. I shy away from conventional treatments unless they're curative. Okay. And the same with my child. I got a 12-year-old daughter, and yeah, there are some conventional things that I have done with her, like antibiotics, things that I would do for her, like take her tonsils out. So I want to play this middle ground with what's best for cure. Connie, he said strep now. Should I do the antibiotics? Yes. Zulika, my son does IVIG. It's okay to give Panda Bear? Yeah. Christina, how long typically does treatment take? Like I said, months to years. Is it lifelong? No, but it takes a long time. Christina, does Trehalose help? Wow, we haven't talked about Trehalose in a while. I don't see Trehalose helping pandas or pants. What Trehalose does is it helps remove toxic elements or scar tissue in the brain. I don't use antibiotics to help the strep, which can damage the heart. Oh, my son's functional medicine said if I don't use the antibiotics, the strep can damage the heart. Sorry, that's Amber's question. Yeah, it's true. If you don't kill off strep fast enough, it can cause heart and kidney issues. It's true. Okay. That doesn't mean antibiotics are the only answer if you've got to kill the strep fast. All right. Jen, can I use sweet tasting gut binder instead of activated charcoal? Yes. Amber, I recommend you to all the moms I talk to. Thank you, Amber. I appreciate it. I want to help everybody I can. Connie, do you have antimicrobials in your shop? I do. We have colloidal silver, grapefruit seed extract, GFSE, biocillin, Paraslayer, Viraglon. We got some great antimicrobials. Haley, I wanted to say I've been trying different supplements with my son since April. I finally started Power and Focus a couple weeks ago. I've seen the most change since starting Power and Focus. Looking forward to seeing what's to come. Haley, I love it. You know what I love about that? The hope. Okay? So many parents out there. You guys have been in that situation. Just feel like there's no hope. There's nothing you can do for your child. Okay? You found hope. That's what I love. All right? Yes, it's great that it's our Power and Focus supplement, but you're seeing changes in your child, which means change is possible. That means change is possible for other parents. Mariana, hey doc, may I ask, is it safe for a 5-year-old to swim in a sulfuric hot spring? I think so. I mean, except for the temperature. Be careful of the temperature, but yeah. How long? 20 minutes? 4 times a week? Is it safe? 20 minutes per swim? I think so. I can't think of any contraindications. Patricia, what do you find is most suitable to balance neurotransmitters in children? All right, Patricia, I've created a supplement protocol called the Skowron solution, which is 4 different supplements that balance brain chemistry. Okay. The Skowron solution was created based on 15 plus years of my clinical experience and scientific research using natural therapies to balance neurotransmitters. And that has been my core and wheelhouse of my practice for 20 years because it works for language, behavior, sleep. It works. So try the Skowron solution. All right, Megan, I saw your last Instagram reel. You recommended grapefruit seed extract and the gut binder. Why does it have a lead warning? It's because of one of the ingredients may potentially have lead, and it triggers a warning that's required in California to be put on a label. But every single product we make goes through heavy metal testing. It goes through infection testing. We make sure these are the supplements I make for my patients. These are supplements I personally take. I don't want anything bad in them. So yes, every single product we make goes through that heavy metal and toxicology analysis to make sure it clears. Okay. But if there's a potential, California law makes us put that label on. Should I add the yeast mold biofilm with those? I would. Yes. Bella, good morning. Hey, Bella, how you doing? I wanted to ask for my 15-year-old. She never gets sick, but almost has a headache on a daily basis. Her eyes hurt and get a dazed look. We're waiting on the EEG results. All right, that's good. We'll do a stool test, but besides vitamin B complex, what could we do for her? I find most headaches come from food reactions. So see if you can keep a food journal and just kind of track what foods trigger, what foods does she eat on a day that she gets the headaches versus not. But if she's also talking about her eyes hurting, could be a sinus infection behind the eyes. We have sinuses behind the eyes, not just here in the nose. We have some in the cheeks. We have some up here. It might be sinus infection. Try our NAC. NAC might clear that. As a teenager, will PANDAS and PANS get worse for the brain? I don't think there's an age where it gets worse. I just think it sucks overall. Sandra, can cavities cause a PANS flare? I don't think so. But if there's an infection associated, yes. Molly, my son is overly silly and hyperactive. I'm assuming yeast. I agree. We truly can't afford much. We could go with one shot to help. What should we try? Is there anything a doctor can prescribe? I would do this, Molly. You want a binder. Start with a binder, okay? If you want our gut binder, you can go with that. It's a very comprehensive binder supplement. If you want to go on the basic, then just get some activated charcoal, all right? Then go to your doctor and ask for antifungal medication like nystatin or diflucan or ketoconazole. But you got to have that binder. I just talked to a patient today. Daughter's 6, behavior's off the roof, and took antifungal medication, diflucan, and things got worse. And, the classic die-off reactions. I'm like, well, did you give more binders? Like, we didn't give any binders. So you've got to give these binders, like our gut binder sweet tasting, or if you want to go basic, just activated charcoal. But then add on the pharmaceutical antifungals. You guys are asking great questions today. Teresa, I love this question, Teresa. My son has high B12 in his blood. What does this mean? What does it mean when you have high B12 levels in your blood? Number one, it either means you're taking a B12 supplement and it's too much, so you need to back down. But if you have a high B12 level in your blood and you're not taking B12, it means it's not being used in the body. So what you want to do is give folinic acid. Folinic acid will pair with the B12 in your body and go to work. All right? So try our superfolinic acid if you haven't. Linda Lynn, how do I order products? Great question, Linda Lynn. Go to our website, spectrumawakening.com. Don't forget to use coupon code PANDAS20, which is good until December 8th. Jasmine said her test was a mineral hair test. All right, Jasmine, let me say this. All right, everybody, listen up. I'm the bearer of negativity again. Hair tests for minerals are not accurate. Okay? I said it. Hair tests for heavy metals are accurate. Okay? Hair tests for heavy metals are just not accurate. Boy, wouldn't it be great if it was? But trust me, I've talked to the head of the lab that told me, look, basically these are not super accurate. We sell this test and we do this test because so many people want it. So from a financial perspective, the lab sells so many of those tests, they keep that part of the test on there. But I would not make any treatment recommendations based on that. I would always confirm it with urine or blood. Molly, my son has low iron, but iron supplements cause constipation. We already struggle with withholding. Should we supplement anyway? Yes, you need that iron, but pair it with something that loosens the stools, like our brown log train. So pair it with brown log train, pair it with magnesium, vitamin C, so that you don't get constipated. TJ, our pediatrician, finally agreed to do blood work for my 5-year-old. Yay! LH levels were elevated. She thinks that's why he's displaying some sexual behavior. What do you think? I believe that, TJ, great question. No child, no one should have an elevated hormone from the brain. And you need to figure out why. I don't want you to take something just to lower that level without finding the answer to, hey, why is that elevated? And is there another problem behind that? Go to an endocrinologist, go to a pediatric endocrinologist and say, WTF, and let them figure it out. Okay? Christina, if PANS is suspected, should we work on that first or a gut infection? Or treat it simultaneously? Simultaneously, Christina, just knock all those infections out. Nargis, what's the best test for PANDAS or PANS? I don't think there is one. Amber is sharing. Thanks, Amber. Megan, if you see your kid more sensitive to NAC, is it best to go with glutathione? I would say this. A lot of people with yeast infections get triggered with NAC, so you may want to treat a yeast infection, or give this stuff not orally, okay? Give it topically. Like we have a glutathione cream. I got it right here. There we go. You can rub glutathione on you. So if you can give it some way that's not oral, you shouldn't have those reactions. Sherry, has anyone studied genes in pandas? They have. They have. I saw that research study as I was preparing for this podcast, Sherry, but I didn't print it out because I just thought it was kind of off topic. But they have. They're mostly around GABA genes, some of the shank genes, which are really common in autism. But what interests me is if the GABA genes are clinically associated with pandas and PANS, would giving GABA help the behaviors? It might. All right, Connie, he says he hits me so hard. Yes, Connie, I want to answer this again. When your child hits you, they're in pain. Okay? They're trying to express their pain to you in the only way they know how, and they want you to help their pain. That's why they're doing it to you. So find the pain. Is it a cavity? Is it an ear infection? Is it a headache? Or is it a gut infection, which is most likely? Try our yeast mold bundle, Connie. Treat the pain. Find the pain. Save the cheerleader, save the world. What was that? Forgot. That was a TV show on NBC a while ago. Linda Lynn, can pandas initiate seizures? Yeah. Yeah, 100%. One of the most common symptoms of pandas, not PANS, is seizures. Alexandra, is it normal for my 6-year-old to be very depressed? No. This is the good times of life. You should be happy. Try our super serotonin support. All right, I got time for a couple other questions, guys. These are great questions. I love them, but we're going to cap it because of the time. Sherry says, what happened to my son is he regressed after MMR, which is a very common story. He always extremely sick after his shot. 6 years after MMR, his measles titer was 4+. They tested him for an active infection, which he didn't have. When he went to the immunologist, I questioned it. And the immunologist, and they weren't worried about it. So this is conventional medicine. You know, conventional, when you're in the box, you're in the box. When you're in the box, okay, and you have a vaccine for an infection and your immune system has a response, they believe that's good. Okay, that's their dogma. They're in the box. Outside the box, we think a little differently. We want the immune system to be fighting the vaccine infections, okay? But we don't want them to be overly fighting it. Because if they're overly fighting it, then is there this autoimmune reaction, the identical twins happening? And so I run this MMR titer a lot on my kids, on my patients. And I'll normally see the rubella normal, which is great. You're immune to rubella. I'll often see the mumps normal, but not all the time. And most of the time I see the measles super high. So why is the measles super high in the immune system, but the mumps and the rubella normal? Okay, this is my question. Then we add on all this other science. This is in the box versus out of the box kind of stuff. Okay. Alexandra, a couple more questions. Alexandra says, is it normal for my 6-year-old to be depressive? He constantly says he wants to be normal. He's always saying he wants to die and go to heaven. Boy, those are tough words to hear, aren't they? Just tough words when a kid says that. Try our super serotonin support, but also go for a gut infection. All right. Let's get behind that emotion. Why? Why does he not want to be around anymore? And this is for anybody, honestly. For people who say, you know what? My pain, my physical pain, my emotional pain is so bad, I'd rather end it than deal with that pain. And that's really the basis of suicidal ideation, okay? This pain is so bad, I don't want to deal with it. Let me end the pain. You got to find if that's physical or emotional pain, Alexandra. So try our super serotonin, try our yeast mold bundle. But think along those lines. When somebody's sad, what physically or emotionally is taking away the happiness? Because I feel most people have a thermostat of happy, or I'd like to think that. Oh, good luck, Alexander. All right, last question, Denissa. Can I give Common Cool with juice? Directions say to give it with water. You can give it with anything you want. I don't care. Get it in the kid. Get it in. That's all that matters. All right, everybody. This was a great podcast. I love your questions. I love that you're involved in trying to help your kids. So let's sum up, okay? PANDAS and PANS is an autoimmune condition that attacks the brain. It's caused by an infection. It's caused by a virus. It's caused by strep. It's caused by COVID. It's caused by Epstein-Barr. It's caused by a million different things. All right. What happens is after a cold, your child's behavior goes off the charts. All right. That means your child has this long-standing autoimmune inflammation against the brain and probably has a chronic infection that it hasn't gotten rid of. How do you treat this? Kill that infection. Use our natural antimicrobials like colloidal silver, grapefruit seed extract, biocillin, Paraslayer, Viragon, okay? And help normalize inflammation with anti-inflammatories like our Panda Bear, our curcumin, and a fish oil omega. Don't use the anti-inflammatories when your child's acutely ill because that'll delay how quickly they get better from their acute illness. If you can, take out the tonsils and adenoids, okay? Many chronic infections live there. If you take those out, I've just seen great improvements in many of my kids. Not everybody, but a lot. All right. So it's a lot. And like some of you asked, and I'll repeat the answer, this takes months to years. Now, it's not months to years and then it's gone. It's a gradual kind of exponential change, but it's a long